Come through, Bruce. I'll jump in, Maria, and good to go. Hello, all. Hello. Howdy. Audio level, David Crisafulli, testing 1, 2, 3. Just going to open with a few words and then I'll hand over to Bruce. But please, everyone, I just want to express the significance of what you're seeing here this morning. For representatives of well-respected bodies as well as practice owners to stand up and call this out for what it is shows how serious this is and why we have to work towards shining a light on what is a massive pressure that will be borne on Queenslanders. Make no mistake, the Palaszczuk government's patients tax will cost you more for your child to see your local doctor. It is that simple, and it is being felt in communities across the state. And on 26 occasions before the last election, the Treasurer said there would be no new or increased taxes. Well, nothing has changed from a single medical practitioner across the state. Their business model remains exactly as it was, and yet in the shadows of Christmas, a new tax grab was implemented that will be passed on to patients. In the middle of a cost of living crisis, why would you charge people more to see their GP? And in the middle of a health crisis, why would you funnel more people into an emergency department that is already bursting at the seams? It doesn't make sense. It is a broken promise. And today you will hear why it matters. Today you will hear why it is important that as a community it is called out for what it is, and we do everything we can in an environment where people are looking at every single dollar to show the government that this is a broken promise and it will cost Queenslanders in their hip pocket. Bruce, I might actually ask you to start and then you can hand over to Maria.
Yeah, so thank you very much. So this is a tax on the patient's rebate. So this is an increased tax that will come out of the pockets of patients directly from your Medicare levy straight into the pockets of the state government. So it will cost patients more, and that's a problem. It is a problem all around the country. I would like to thank the Queensland Government for working with us to try and work through it, for the no retrospectivity part of this, and entering into a cooperative arrangement. However, that's not enough. I would urge the Queensland Government to continue to lead and to actually stop this additional tax on patients that will drive up costs, will drive up out-of-pocket costs, and will drive down bulk billing. So it is time for the Queensland Government to step up and to lead the other states and to stop this really regressive tax on healthcare. Maria.
Hi. Dr. Maria Bolton, AMA Queensland President. Where do you want me to look? Down the middle? Excellent. Payroll tax is a tax on patients accessing their GPs. This is an immoral tax. This will affect our most vulnerable patients. When you think about patients who frequent their GPs, it's patients who have chronic disease, the elderly, young families, and this is going to affect them the most. We are asking for patients' access to GPs to be payroll tax exempt. We need urgent action on this. There are already practices and patients being affected by this immoral tax. Now, I'd like to introduce Dr. Aaron Chambers. He's a GP and practice owner in Brisbane. He's been one of the practices that has been affected, unfairly so. His practice was actually deemed to be compliant before there was a change in the way that they interpret this law. And he's one of our members that has been affected, similar to other members, and we thank him for actually speaking out. And Dr. Aaron Chambers. GP practices already pay payroll tax on our employees. The fact of the matter is that there's been a change in the interpretation of the law as pertains to patients being seen by their GPs and accessing healthcare services. When a patient goes to a public hospital, that service is payroll tax exempt. It's payroll tax exempt for a very good reason. It's because it is healthcare. It's an essential need that humans have in Australia, and that is why it is so important, and this is why we're here. We're here for patients. We're here because patients deserve to have access to their GPs.
Hi there, my name's Aaron Chambers. I'm a GP in Brisbane, on Brisbane South at Grow Life Medical and the founder of Grow Life Medical. I'm happy for any questions if you'd like to ask. And first of all, I guess up front, I don't sit on any side of the political spectrum. Really, my sole focus when we started our clinic is to look after our community. We do not make much money, if any, out of running a general practice. The whole idea is that a general practice exists in a community, a bit like a hospital exists, to connect patients with their doctors. And that's why, for very long historical reasons, GPs are not employed by general practices. The general practice is simply a location where patients can meet their doctor, and GPs are actually customers of the practice in the way this works. So you can imagine, to answer your question before, how crazy it is to be levying a tax on a company on the earnings of their customers. It just makes no sense. And there are very good reasons why that's historically been the case, because GPs are all about looking after the individual in front of them. They're highly trained, autonomous individuals, and they have to have the independence to be able to look after that patient in the way they see fit. And the relationship between patient and doctor and Medicare is predicated on that being a direct relationship. So any argument where you say that a GP works for a practice, it simply is not true. So that's the first point. The second point is that this, now across the state of Queensland, across political lines, any GP or general practice owner understands the impact that this is going to have. And it's pure and simple. It is a tax on patients when they come through the front door. It is a tax on the federal Medicare levy, which is intended to support patients to see their doctor. And even more importantly, and from the state government, and I recognise the state government is doing an excellent job at working with the federal government to increase the desperately needed change to Medicare rebates to patients. But what isn't a good idea at this time is that general practice is actually the economic solution to the problem that the state government is facing in the hospital system. So the roots of the issues that we see in the hospital system are to do with long waits in general practice and difficulty with accessing continuity of care. Now, the worst thing you can do when the problem in your hospital system has its roots in underfunding of primary care is to put even more tax on patients seeing their GP, because GPs, they know the individual, we're able to look after your problem in a longitudinal manner, and we can nip things in the bud before they become a big problem and before they become so costly to the state system. So that's why we're calling for this to be abandoned, because it's not good economic policy for Queensland. It's not good policy for individuals. You know, I mean, I don't know about you, but my cost of groceries has gone up astronomically in the last 12 months. And we see that in patients. And if they have to choose between the cost to see their GP going up 15% versus putting food on the table, I'm pretty sure food's going to come first. But healthcare is also essential. So that's, I guess, the crux of why we're here. The mathematics are quite complex for this because of the way that the tax is being levied on the customers of the practice, but effectively it's going to mean that every patient in Queensland is going to have to pay around 15% more to go and see their doctor. And the big challenge of that is that Medicare rebates are fixed. And so the most vulnerable people in our community are the ones who rely on bulk billing, and GPs, you know, for a very long time, we don't do this because we want to be some highfalutin specialist and get paid $1 gazillion. We do it because we care about the individuals who we look after, we care about our communities, and historically we redirect anything that we can into supporting the most vulnerable, and governments aren't able to see down to the microscopic level as to who is genuinely most vulnerable in our community. I know plenty of single parents or even dual parents where they've got a couple of kids. They don't have healthcare cards, they don't get any government subsidies, and it's really a struggle to make ends meet. Someone who's come from a good job and then lost their job, it's also difficult. a good GP will generally try and compassionately bulk bill that individual, but this decision makes it just impossible because you can't adjust that rebate. So, you know.
Are you advocating for payroll tax to be, suspended on purely the income of those contracting doctors and GPs, or would you like to see it across all staff within the GP? How broadly would you like this?
Sorry, I'm not quite clear on your question. What do you mean?
I guess the Treasury officials have told us this particularly only changed the interpretation of the fact that the payroll tax is now levied on this contracting doctors in the GP.
Yes.
Staff within the non-GP always.
Yes, we already pay payroll tax on those staff. I think we would be happy for a decades-long status quo to remain as it is. This is really a new way that tax is being levied on general practice. That's the problem. I think everyone's happy with the status quo, although admittedly Medicare rebates are too low. But we're not asking for special exemptions around our employees. We're just asking for a fair go to look at, well, these are our customers, not our employees.
Do you mind if I answer that question?
Yeah.
So quite clearly what we're asking for is not an increase in the tax. So the tax not to change. So currently practices do pay payroll tax on the employees in our practices. And fundamentally, we're happy to do that like any other business in the country. But what's changed is the way that the tenant doctors who work within the practice, who buy services from the practice, essentially their entire income is now being considered as subject to payroll tax. So that's a bit under 5% off the top of every patient's Medicare rebate. Every payment that any patient makes to the practice now goes directly to the state government. And that's just not tenable. It can't be absorbed by practices. The RACGP has done some surveys, and only 3% of practices said that they could absorb this tax. 87% of practices said that they would have to pass it on, and 1 in 5 practices said that felt that they would probably go broke with this new tax burden. Unfortunately, this comes on the back of decades of chronic underfunding of Medicare for general practice. And so, as everyone knows, general practice is already at breaking point. This is more than the straw that's breaking the camel's back. Yeah, so to be quite fair to the Queensland government, I think that they are being honest in being upfront about the way that it's being interpreted. My sense is that the other states are really proceeding on very much the same lines, and so this is a national issue across all of the states, in my opinion, where I think Australians right across the country will be paying significantly more. So I do think the Queensland government has showed some leadership about being honest and upfront about the way they're approaching this tax. I would call for them to continue that leadership and really stop this really regressive tax on all Australian citizens and a sick tax on our healthcare system. Yeah, look, we're still talking to the Queensland government, still talking to the Queensland Revenue Office, hopeful for a reasonable outcome. But really the best solution is that there's legislative change that really protects patients from this increased tax burden, and certainly calling on the Treasurer to introduce that legislative change.
Last year. Look, essentially at the moment we haven't increased patient fees, but with the ruling just before Christmas, we're actively talking about what we're going to do about this, because it puts a massive, even further hole in how to proceed forwards. So it essentially means we're looking at probably a 15% increase in patient fees, and it's going to mean probably having to abandon bulk billing, possibly for everyone or possibly for only a very tiny few circumstances of exception. And I know there are practices very close to us where they've historically bulk billed everyone, and they've literally just given up on that based on this ruling just before Christmas. It inevitably means that there's going to be increased fees to patients. This is a tax on patients and their Medicare rebate. Look, I'm really worried about the people we don't see, because I know it's exactly the people who most need healthcare and are most vulnerable. We know that the people who have lowest income are at most risk of adverse health outcomes, and they're also exactly the people who are less likely to come because of that financial barrier. They're the ones I'm most worried about, and we want to be able to support. But without sufficient federal funding to Medicare and with an added tax on patients, it just becomes impossible. And we can't do it and make a loss. No business can work like that. Yeah.
Keep going and then I'll... Before we go to the other issue, can I just jump in if that's okay? So, and then I'll go to Maria. My name's Nicole Higgins. I am the National President of RACGP. So, my name's Dr. Nicole Higgins. I am the National President of RACGP. I am also a GP from Mackay and a practice owner. This is a tax on Medicare. This is a tax on patients. And what this is now going to do is undermine any national reforms that the federal government is trying to implement with Medicare. But more importantly, what it means for our patients is that it will increase the gap. It will kill bulk billing. It's going to put increased pressure on our hospital systems, our ramping, and our overflowing emergency departments. This is a national problem. I would like to see Queensland take the lead, but we have National Cabinet on Friday, and this is having discussions with Minister Butler on Thursday pre that meeting. So payroll tax, it is harmonised amongst the states. It has been discussed. There's a case started in Victoria, New South Wales, and this will be rolled out nationally. What this will do is break the general practice system. It will break being able to see your GP, and it's going to mean that across Australia and across Queensland, particularly, people are going to struggle to see their GP. Yep.
You talk about status quo. Other sectors, for example, how are they being affected by payroll tax? And is this new interpretation also
You'll find that this will affect not just the medical industry but also allied health, and everyone's seeking their own individual advice at the moment given the recent QRO ruling in December. I'm a GP, so that's where I live, and I think everybody else, they're all just getting their advice to see what's going to happen in the future. But the critical point about general practice is that it's already at the brink. You already have patients who, they can't afford to buy medication at the pharmacy. Do you want to add another stress on them where they're not going to be able to access a visit to their GP? No. I think a reminder that general practice is amazing. GPs, having a relationship with your GP is like having a super drug. They keep you healthy and they keep you out of hospital. And basically what this tax does is that it goes against all of that, and it's immoral. Most definitely. So if Queenslanders become sicker because they don't have access to their GPs, it'll cost more money in managing those chronic illnesses, in emergency department presentations. GPs are really cost efficient. We love what we do. We love looking after our patients. Please ensure that patients continue to have access to see their GP. Yeah, I haven't had a chance to read the report, so I'll take the question on notice. I've just been very busy with GP issues and also the logjam hospital report that came out of AMA Federal this morning, but I'll take it on notice.
very, very much.
Thanks. Right. You want David back?
Sure.
Okay.
Yeah, thanks. Thanks, guys. Thank you very, very much.
Quickly on some of the medical stuff before we move on. The government says that obviously other industries like, say, even coal and wood, they
Sure.
pay payroll tax on contractors.
Yeah.
Using an example would be security, cleaners, aspects like that. If we start seeing tax exemptions for contractors in the GP sense, does it open up a whole can of worms? What would you, if you go down that path, would be tempting other big corporations?
We're asking for nothing more than business as usual. And these people have built a business model where the GP operates as a contractor in that facility. And it's been like that for decades and decades. The only thing that has changed has been the interpretation of the Queensland government. And yes, there's been a ruling in another state, but on the back of that, the Treasurer decided in the shadow of Christmas to send a present to the tune of asking medical practitioners to charge more for their patients to see a doctor. So I can understand, like all businesses, they will have to pay payroll tax on their staff. They have a business model that for ever and ever has allowed doctors to be independent of that business, and that's the way it should be. And no one's asking for a payroll exemption. They're asking for the law to be applied the way it has for generations. And without it, Queenslanders will pay more to go to the doctor in the middle of a health crisis. That doesn't make sense.
I understand why other businesses might be jealous of the situation that GPs get.
And if the government changes the rules for other businesses, we'll go into bat. That'll always be my style. What I'm doing here is fighting a change, a retrospective change after businesses have made a business model which allows patients to be the beneficiary of that, and that's worth fighting for. Anytime the government breaks its promise to charge new or increased taxes, we will go into bat, and we have done that consistently. And the Treasurer said 26 times before the election that wouldn't occur. 26 times, including when asked directly. And since the election, I think Queenslanders have seen what has occurred, because they have raided every honeypot, because they have wasted money. Things like Wellcamp has been an unmitigated disaster and a proof that this government doesn't respect money. And as a result, they have to find new ways of trying to prop up their bottom line. Every time an infrastructure project blows out in time and budget, they need to find new ways. And make no mistake, this is retrospective. It has changed the way that something has been interpreted for decades. That is a new tax, and it is a new tax on patients, and they're feeling it. And the government is going to feel it, because doctors are communicating with their patients as we speak. And in the same way we went to bat when the broken promise on the renters tax, because it would flow through, and we saw the humiliating back down, the same playbook will occur. But it shouldn't have to take months on end, because people are making decisions now. Businesses are making decisions about their viability. Patients are making decisions about whether or not they can afford to take their child to see a doctor. That isn't a modern Queensland.
The government said this really will only impact a very small number of GPs and really only levy perhaps less than $1 million. So is that figure really going to cause much grief if it does affect the people?
Well, I trust the doctors over the Palaszczuk government. And yesterday I was with the Deputy Leader in Caloundra, and on a moment's notice there was representatives from half a dozen clinics, and you heard the most passionate response yesterday about what it means to patients there on the ground. The government has not said what this change in their interpretation, this new tax, will raise. They don't know. But I know, having spoken with doctors in Harvey Bay, at Paradise Point, at Bow Desert, Brisbane today, I think they've picked the wrong fight on the wrong issue. Right now, cost of living is the prism that every Queenslander is viewing every interaction with their government. And when they go to their trusted GP and they can no longer bulk bill, or it is costing them more to go and see the GP, and the reason is because of a new tax, I believe that there will be some very strong points made, and I have every faith that if we conduct the argument in the same way we did with the unfair renters tax in the middle of a housing crisis, we will be able to have a win on a patients tax in the middle of a health crisis.
If you're elected next year, just to be clear, you won't make an exemption for GPs, but there will be a reverse in the interpretation.
Well, let me answer that exactly the same way I answered when you asked me the question about the renters tax. It shouldn't be for these guys to have to wait nearly 2 years for an interpretation that they have built their business model on for decades. Now, if we get to the next election and it's a choice between whether or not I'm going to slug GPs more to do business and have patients have to pay more, you probably know what side of the ledger I'm going to fall on. But I'm not going to let the government off the hook, and I'm not going to make it easy for them. This shouldn't be a decision that Queenslanders get to make in October in 24. This should be a decision the Treasurer makes today, because nothing has changed from their business model. Nothing. And all of your questions were completely valid, but the answers were too. They have built a business model around providing low-cost care for people in need. The only thing that has changed is Cameron Dick's desire to get into their hip pocket of their clients. Nothing else has changed. Now, yes, there have been rulings in other parts of the country, but a government here that is very short of money because it can't manage its money, so it comes after yours, has made a decision to charge patients more in the middle of a health crisis. And we are going to continue to expose it. And I hope it doesn't take another humiliation on the floor of National Cabinet, because in the meantime, patients won't go and see their doctors. And guess where they end up? In the emergency department. And do I have to remind the government how bad the emergency departments are functioning after 8 years of underinvestment, of doctors and nurses feeling battered and broken and bruised, the worst ambulance ramping in the country? And you're going to go and ask people to go and sit in an ED because they won't be able to afford to go and see their GP. Only Cameron Dick could think that makes good economic sense. And don't talk about social sense. It's wrong. Well, we'll start on that. We're all done with all this? Thanks, guys. Thank you very, very much. I'll just make some points about this report today, and then I'm going to ask Fiona to go into detail. Having had a very initial read of it, there are a couple of reforms that have been recommended that I think well and truly show how deep the integrity crisis is in this government and how deep the influence of people are on the government. And for trade unions to be singled out as having undue influence, and the recommendations around that go to the heart of what we have been speaking about for a long time. The trade union movement last year in Queensland donated somewhere in the order of $750,000 to the government, and this report shows why that is cause for concern. It also talks about board appointments, and I think there is something that can be said for the need to make sure there's greater transparency around that. Now, I've spoken a lot about integrity and transparency, and I intend to read this in detail, and Fiona will be taking a submission to Shadow Cabinet shortly. But we have to do everything we can to take people in our trust and be open and transparent. That was the platform the government was elected on 8 years ago. And many of the reforms that are recommended in here, many of the reforms point to the fact that that hasn't occurred. We have a less transparent government now than it was when it was elected 3 terms ago. I might get Fiona to make some comments on the text.
Thanks very much. I wish to address this report. This report is just the latest after 18 months of scandals and with the integrity crisis. This report actually puts a spotlight on the rotten relationship between the Palaszczuk government and the trade union movement in Queensland, and it recommends that unions actually be registered as lobbyists. But there's been an extraordinary relationship here in Queensland where we have seen ministers such as Minister Bailey sharing cabinet documents with union friends, where those union executives have then actually been directing what recommendations within cabinet documents should actually be accepted. The fact that we have had what has been, I believe, a lack of transparency, a way around the way that trade unions have actually operated, not outside the tent, but actually at the table with this government, has to be called out. This report has certainly highlighted that this is not about advocacy, it's about influence within the tent, with people who are being given roles where they're not elected as members of parliament and they're directing the hands of government actually at the cabinet table. So this report actually really highlights the rotten relationship between the trade union movement and the Palaszczuk Labor government. It also makes recommendations in regard to board appointments. The fact that you've got union officials who are being appointed to boards and that there's been concern about conflicts of interest and the lack of integrity and the transparency in this process. At the heart of the issues that we see with the latest report and the spotlight on the rotten relationship with the Palaszczuk government and trade unions in particular is a need for transparency around influence and around decision-making. And the critical issue is about influence and decision-making. And this report is yet another report along 18 months of scandals with the integrity crisis, and still we're yet to see a number of key recommendations from other reports actually implemented. We are still calling for a Royal Commission into the integrity issues in this government, and public servants are still contacting us with a great deal of concern that those who've got influence within not just the corridors of government but behind the chairs of the cabinet go far and above what people are seeing, and there needs to be transparency and integrity. That's why this latest report is so important. I'll be taking a submission to Shadow Cabinet in the near future, and the critical issue will be around influence on decision-making and transparency. And I think that's really important, because one of the issues we know about is we've got a Minister of the Crown who actually had a cabinet document that was available to a union official who didn't just have a draft consultation paper, actually had the cabinet document and was making recommendations about please pick comrade point number C. So it's important that the focus is on transparency of decision-making and transparency on influence where those decisions are being made. And that's certainly the focus on the points that we'll be taking forward. I think the real issue here is around transparency, and I will support any measure that is going to bring about transparency where there are decisions being made in the dark. And currently there are a lot of decisions of government that are not only made in the dark, they're kept in the dark with commercial and confidence mechanisms. So there's a lot more that needs to be done in this space. I think that this report is an important step in the right direction, and we'll certainly be looking at the detail. But one of the highlights has certainly been around this issue of the trade union movement, because they're one of the biggest donors of government. The AMA is very different from the union movement, as they don't give $750,000 to the government that's in power. The AMA is not sitting at the table in Cabinet with a copy of the Cabinet submission. This must be about ensuring that the focus is upon transparency and decision-making, and that people who are actually particularly getting hold of Cabinet submissions, that should be transparent. So that's why we need to make sure that the focus is on transparency of decisions and ensuring that there's accountability around those decisions being made fully public. There's been recommendations around dual hatting, and there's been recommendations about greater transparency with lobbying, with previous reports that have come down that we still haven't seen implemented. My comment would be this, is that there's still a recommendation around ministerial staff and some of their meetings that aren't being reported. So first steps have to be some of the measures that the government says they've accepted, we still haven't seen in legislation. With these latest recommendations, our focus will certainly be about how do you have transparency around decision-making. Those are actually influencing decisions and how those decisions are being made. Because many of those decisions are still being done in the dark and people don't see how those decisions have come about at the Cabinet table.
And so to be clear, that opposition wouldn't believe this report shown problems in the government, that you don't have any position on any of the reforms or recommendations?
With this report, there are a number of recommendations that spotlight certainly the union movement that we've been highlighting for some time and have been on the public record and continue to come out on the public record. In regard to some of the other recommendations where they're wanting to broaden it with people who are advocacy groups, my comment would be I will be taking those to Shadow Cabinet. The influence, though, the spotlight has to be on points of influence around decision making and where decisions are being made, making sure that's transparent. And that point, I believe, needs to go far further. And we still haven't seen mechanisms to ensure that how decisions are made are in fact fully transparent. And then you'll know the full scheme of those who actually may already be on a lobbyist register. But if you don't see how those decisions are being made, you may not in fact connect the dots even with lobbyists that are already registered.
Yes. Yes. We will be meeting on Friday. Yes, I have. And I'll be taking it to my colleagues and talking to them on Friday. No, I'll take it to Shadow Cabinet, which is the best thing.
The government's consistently criticised you for having no access to things.
Yeah.
After the phase that they're not going to have them anymore. We scheduled the whole one last night. Did that go ahead? And what decision-making influence the people who attend those functions have on themselves?
It's important that we declare in accordance with the law. That is fit and proper. It is also important that we make sure that we have every opportunity to have a fair fight. Because at the moment in Queensland, the laws have been changed, so the ability for anyone to donate large sums of money is finished. It's over. Aside from the registered trade unions. And, say again? Yeah. So 26 named trades unions are a pretty handy lead, though, I would surmise. It's a pretty good start. And the government has had no qualms deliberately giving unfettered access, decision-making, and the ability for those unions not just to bankroll campaigns, but choose who runs in them. Now, there's no other parallel with that. No one in any other industry gets the level of access that the trade union movement gets on this government. No one else. And that's why this report is highlighted. Everything I do will always comply with the law. Everything. So I will. But I will always comply with the law. And any declaration will always be made, down to the cent. That's always been my style, and always will be. Well, that. Because you comply with the law, and whatever the law of the land is, you should always comply with. And if I wasn't, I would expect you to pepper me with questions. Well, with the greatest of respect, complying with the law is being upfront with Queenslanders. If you are willing to do what is right, and you are willing to always be above board and comply with whatever legislation gets put forward, even when that legislation means that an individual union can give $1 million each and no individual can give more than $10,000 over a 4-year term, if they're the rules, I play by them. Now, they might be unfair, they might favour the Labor Party who drafted them, they might be the greatest financial gerrymander this state's ever seen, but I have to comply with them, and I always will. And I think that's fair and reasonable.
You can't say many people went
I'll comply with the law. Surely that's fair. And if the law was if somebody gave $1.50, they were declared, I'd declare it. That's the way that people who are above board conduct themselves. You comply with the law. So if the speed limit's 100, I don't come to you and say, hey, you're doing 80, mate, what's the issue? A police officer will hold you accountable if you go over 100. That's the way laws work. People comply with laws. And if they don't comply with laws, they should have the book thrown at them. Now, it's a little bit rich for the people making the laws to say that one car can do 250 and the other car can only do 10 kilometres an hour, but it is what it is. And that's the analogy that where we are. But I'll comply. And despite that, I have every faith that Queenslanders at the end of 2024 will see a contrast between what we are offering and what the government has presided over by that stage after 10 years. And despite the financial gerrymander, I have every confidence that people will opt for change.
The same reason why Queenslanders might be interested in how much trade unions are giving to the government, they also might be interested in how many people go to your cash.
Sure. And any person who, any donation that goes above the threshold, which in Queensland is $1,000, will always be declared. That's fair and reasonable. Even if that donation comes in 10 lots of $100, that'll be declared. That's the law, and that's the way it should be. Thanks very much, guys. See you, mate.